Welcome to Study with Acuity. Today we'll be going over food-drug interactions. Let's get started. So on your home screen, go to Verified Sets. On the upper right-hand corner is going to be a light blue block. Click on it. And so under Verified Sets, we'll be looking for food and drug interactions. So click on it. We'll go to Advanced. So advanced questions are going to be mostly case-based. You may have some simpler questions that are not case-related, but you will be encountering a lot of case-related questions. So let's get started. A 56-year-old patient who recently underwent a kidney transplant is prescribed cyclosporin, an immunosuppressive medication to prevent organ rejection. The patient enjoys consuming grapefruit regularly as part of their diet. What can happen to the drug levels if patient consumes grapefruit? Decrease, stay the same, have no effect, increase. I would say increase. Yes, let's find out why. So many immunosuppressants like cyclosporin, tacrolimus, sirolimus, and even everolimus are known to interact with grapefruit or grapefruit juice, any extracts from grapefruit, and therefore most transplant recipients are at high risk for food-drug interactions, okay? Because the grapefruit or grapefruit juice can lead to inhibition of CYP450 enzymes that reside in the gut wall, and to a lesser extent in the liver, thereby leading to increased peak levels of cyclosporin or any of the immunosuppressants that were listed above. Okay, so patients, kidney transplant patients should avoid grapefruit juice while on immunosuppressive therapy. Let's go to the next question. A 60-year-old patient with COPD has been prescribed theophylline to help manage their condition. Theophylline is a derivative of which of the following components that is found in caffeine products? Will it be, is it a derivative of methane, benzene, ethanol, acetylene, or xanthine? So let's see, our time is going. What do you think? I will say xanthine. Let's go. So avoid eating or drinking large amounts of food and beverages that contain caffeine. So like chocolate, colas, coffee, and even teas, since theophylline is a xanthine derivative, and caffeinated foods or drinks do contain xanthine, okay? They're xanthine compounds. So we want to be very careful because you can have augmented effects or higher chances of toxicity from the drug since you have higher serum levels of theophylline as a result of co-administration of theophylline and caffeinated drinks, okay? So patients that are on theophylline should avoid drinking coffee or eating high amounts of caffeinated food products. Let's go to the next question. A 40-year-old patient recently diagnosed with a medical condition that increases the risk of kidney stones is concerned about minimizing this risk through dietary choices. The patient is particularly interested in managing their oxalate intake, as it is known to contribute to kidney stone formation. How is oxalate primarily excreted? So oxalate is a very unique compound that is found in vegetables like spinach, even rhubarb contain oxalate. Is best to cook spinach or steam your vegetables to degrade this compound before eating. But let's go because our time is running out. What do you think? I would say excreted in the urine. Awesome. So let's look at the explanation. Dietary oxalate is plant-derived and may be a component of vegetables, like I mentioned, spinach, rhubarb, chard, contain oxalate, nuts, some fruits, and grains. So the amount of oxalate excreted in the urine plays an important role in calcium oxalate stone formation. Remember, calcium oxalate is a very important compound that is present, that is involved in kidney stones, okay? So we want to be very aware of that so we can counsel our patients that to help prevent kidney stone formation. So large epidemiological cohort studies have demonstrated that urinary oxalate excretion is a continuous variable when indexed to stone risk. Thus, individuals with oxalate excretions greater than 25 milligrams per day may benefit from a reduction of urinary oxalate output. This is very important, okay? The 24-hour urine assessment may miss periods of transient surges in urinary oxalate excretion, which may promote stone growth and is a limitation of this analysis. However, in this review, we describe the impact of dietary oxalate and its contribution to stone growth. So to limit calcium oxalate stone growth, we have to advocate that patients maintain appropriate hydration, drink loads of water, advise your patients, drink loads of water, especially when they're consuming high oxalate containing foods, okay? Remember, like I said with the vegetables, just steam it a little bit, cook it before you eat it. Just don't eat a lot of raw spinach, rhubarb, or chard. You can eat it raw, but smaller quantities, okay, to avoid promoting the kidney stone formation, okay? But hydration is key. Drinking loads of water will help prevent kidney stone formation. Avoid oxalate-rich foods, especially if you have recurrent kidney stones, and consume an adequate amount of calcium, okay? Now, let's go to the next question. A 42-year-old patient with a history of occasional headaches and mild back pain has been prescribed acetaminophen for pain relief. The patient occasionally consumes alcohol. Recently, patient reported increase in chocolate, cashew, alcohol intake. Patient does drink coffee occasionally and takes Motrin as needed for headaches. During his annual checkup, patient was told he had elevated liver enzymes. What could contribute to this? So what can cause this patient's liver enzymes to increase? So let's see what this patient is on. This patient enjoys chocolate, coffee, and drinks alcohol. That's a big one. That's a key one. Alcohol, takes Motrin and NSAID. Oh, our time ran out. That was such a good question. So be mindful of the time always. Let's go. A 48-year-old patient who received a liver transplant is prescribed tacrolimus and immunosuppressive medication to prevent organ rejection. The patient has a habit of consuming grapefruit and grapefruit juice regularly. What is a secondary metabolite found in grapefruit? So what is a secondary metabolite that is found in grapefruit that has an impact in food-drug interactions? I would say is the furanocoumarins. Let's look at the explanation. So active chemical compounds in grapefruit known as furanocoumarins are primarily responsible for the CYP450-3A4 interactions, okay? So furanocoumarin derivatives are found in grapefruit, and they include the bergamottin, epoxy bergamottin, and 6'7' dihydroxy bergamottin. Let's go to the next question. Which specific compound in grapefruit is responsible for inhibiting the enzyme CYP3A4 potentially leading to higher levels of levothyroxine in the bloodstream. Oh, we just answered this question. So what do you guys think? So this is really important, right? So if you are inhibiting an enzyme that metabolizes a drug, that means you end up having higher serum levels of the drug. So we just learned that grapefruit contains furanocoumarins. So that's the answer. So this is great for knowledge retention, right? Because we just went over a question where this was explained. And so let's look at the explanation. The absorption of levothyroxine can be impaired by soybeans, papaya, or pawpaw, and grapefruit. The chemicals in grapefruit involved in this interaction are furanocoumarins. Furanocoumarins are metabolized by CYP3A4 to reactive intermediates that bond covalently to the active site of the enzyme, causing irreversible inactivation. So this is a mechanism-based inhibition. So this is very important to know, okay, that to know how furanocoumarins actually inhibit CYP3A4, thereby causing higher serum levels of the drugs that are metabolized by CYP3A4. Let's go to the next question. A 60-year-old patient with COPD has been prescribed theophylline to help manage their condition. What food items should the patient be advised to minimize or avoid? So this almost sounds like a question we looked at, but we have different options here. So this is a way for us to think about other foods that theophylline can interact with. So we went over a question where we learned about how theophylline interacts with caffeine containing foods and beverages. Now we're going to figure this one out. So which of these contain caffeine possibly? Chocolate. Yes, very similar, right? So this is going to help with knowledge retention. So let's go to the next question. A 56-year-old patient with COPD has been prescribed theophylline to help manage their condition. Patient is also on a albuterol inhaler, takes aspirin 81 milligrams chewable once a day, Flonase 2 sprays once a day, and in each nostril, and lisinopril 10 milligrams QD PRN. The patient is an avid coffee drinker and enjoys several cups of coffee daily. What is a potential food and drug interaction? What potential food and drug interaction should the physician, clinician, healthcare provider address? We should know this one by now. Coffee theophylline. Yes. Yes. So we can skip the explanation because we've gone over this several times. So now we should know this. A 55-year-old patient diagnosed with hypothyroidism has been prescribed levothyroxine, which is a synthetic thyroid hormone to manage their condition. The patient has been enjoying apple, grapefruit, guavas, and blueberries. What advice should the physician, the pharmacist, the healthcare provider, the clinician offer regarding this potential food-drug interaction? What do you think? I will say avoid apples, no. Avoid guavas, avoid blueberries. Consume more grapefruit, no. Avoid grapefruit. Let's go. Avoid grapefruit. Let's look at the explanation. The absorption of levothyroxine can be impaired by soybeans, papaya or pawpaw, and grapefruit. Okay, these food items would actually delay the absorption of levothyroxine, which is synthroid, leading to the reduced effectiveness of the drug. Let's go to the last question. A 55-year-old patient with a history of atrial fibrillation is prescribed warfarin, which is Coumadin, an anticoagulant to prevent blood clots. The patient is also keen on maintaining a healthy diet and regularly takes mangoes, chia seeds, lemon water, B complex, and fish oil supplements. Which of the food or supplements, dietary supplements should the healthcare provider warn the patient about? What do you think? The patient is on a blood thinner. I would say the fish oil supplements. And let's find out why. So fish oil supplements, they're great, right? These are great supplements. They are highly anti-inflammatory because they contain omega-3 fatty acids, EPA and DHA. So omega-3 fatty acids have multiple cardiovascular benefits, and they can also inhibit platelet aggregation, vitamin K dependent coagulation factors, including lowering the thromboxane, A2, and factor 7. This means that fish oil supplements can promote blood thinning, right? Therefore, if a patient on Coumadin, an anticoagulant, is taking fish oil supplements, they are at higher risk for bleeds. So they have to be monitored very closely for bleeds. And this patient has to inform their healthcare provider about the supplements they're taking. Their INR has to be checked, has to be monitored closely, and some adjustments have to be made. The patient will likely have to discontinue the fish oils, or the doses, the Coumadin dose will have to be adjusted, okay? But the patient needs to communicate with their healthcare provider about what they are taking, okay? The foods they are eating, the green leafy vegetables, and also any dietary supplements or herbs they might be taking. Okay, so let's see what our score is. So remember, we missed the opportunity to finish one question. Oh, we got 90%. We missed one question. So next time we would explore more advanced food-drug interactions, and we'll be mindful of the timer so that we get all questions answered and all explanations checked. Thank you for joining us today. Hope to see you next week as we study with Acuitii.